Hi, thank you. And good morning, everyone. I'm a clinical engineer here in Colombia. I work in Hospital Paula, which is located in Medellin, Colombia, in Latin America. Our hospital is a private general hospital with high level of complexity, and we have about 500 beds, licensed beds, and we are accredited by national and international agencies. Next slide, please. Okay, so healthcare sector and institutions had increasing demand in high quality services, so that impact directly the expenses of the services, and simultaneously institutions are suffering economical constraints because of the high costs related to equipment, personnel, and devices, without limited monetary resources available. As clinical engineers, we have to manage the medical equipment in all of its life cycle here in the hospital. So we have to, we have an important impact on budget of our institutions, and we can add value to our professions if we adopt improvements to decrease the expenses and diminish the expenses. So the first improvement we have done is in our technology acquisition process. So we have the same initial steps, but in this process, we add the participation of IT people and occupational health people. So it led us to include in our technology demonstration and in our technical specifications review costs related to, for example, interoperability networks and costs related to safety use of the equipment. Additional to that, we add a specific step of adjustments. So we do adjustments, economical and technical adjustments based on needs and projection of our institutions. So it led us to diminish cost in our evaluation. And we are continuing using the TCO methodology, but after of that, we are reviewing many options of property, as for example, purchase, rental, or different kind of property options, so we can choose all of the costs. We can have all of the costs included, and we can choose the best alternative available for us. Next slide. Other example and another input we can do as clinical engineers is the participation in the return on investment evaluation of the new services delivery opening. So it is important because it is usual that project managers just have into account just the initial cost of the equipment. But based on the iceberg theory, we know that 80% of the costs are related to hidden costs. So it is important we participate in this analysis because we can add these hidden costs, and we know it could change the entire result of the evaluation. Next slide, please. Okay. Another input we can, or another strategy we have done here in our hospital is it is important to knowledge our services. For example, NICU, ICU, and their needs. So it could lead us to propose low-cost engineering solutions for user cost of damage and to solve problems they had. So as an example, we realized that about 23% of our cost of damage was used the last year. So, and we realized that the high maintenance cost for these cost of damage was related to our flexible endoscopes. So we started a specific measure of failures in our flexible endoscope, and we proposed a process change. So that process change, since the transport and the reprocessing of the device led us to diminish about 80% of the expenses in distal and impact damages, with an investment of about 11%. Next slide. Here are other examples we have implemented with low-cost engineering solutions for problems we had in Colombia. So we proposed the use of 3D printed surgical table control protector because we had a lot of control damages for failure, for full cost. So these 3D printed control just cost about 10% of the cost of the new control. Another measure we had is that we implement a quick guide and accessories for cleaning and disinfection of TE probe in our sterilization process because we noticed we have many damages of our TE probes related to spills and inadequate manipulations from users. And the last picture you can see is the accessories and lens for endoscope testing before cleaning and disinfection because here we had an important problems related to leak tests and the inspections we did before the cleaning process. Next slide. Yeah. Next. Okay. Next, the other important strategy we have done is the participation of the construction of the budget related to technology acquisition and management. So we are guaranteeing that these 5 inputs are present in the budget we construct every year because regulation is changing, so it could have many costs involved to accomplish new regulations or changes, costs related to expansion and opening of new services, technology replacement needs, technology surveillance and technology assessment processes, and changes and costs related to that, and costs related to maintenance and technology upgrades needs, including spare parts. Next. Here it's the importance of participation of clinical engineering departments in planning and execution of construction projects. So we had a teamwork with facilities management department here in our hospital. We participate since the beginning of the project, since the planning and during the execution and implementation of the technology in our hospital. So we can guarantee we have regulatory compliance and user compliance, human factors engineering, technology requirements compliance, and utilities compliance. So with this participation, we can avoid reprocessing costs at the end of the project. Next slide, please. So to accomplish all of these goals and all of these examples I have done to you, it is important to have many leadership principles. Here we have 3 examples of leadership principles we have implemented here. So communication and teamwork with technology users, it's very important because that way we can have a certain communication and know the needs they have. Presence and accompaniment in sanitary services to identify and propose solutions is important for us to be hands-on engineers and participate and to be in the services and from the perspective of engineering proposed solutions and new ways to do our work. And then the creativity and innovation culture, it's very important because it led us to be looking for better ways to do our work. So to finish my presentation, it is important for me to share with you some preparation activities our institution have done to face the COVID-19 pandemic as a high complexity institution. So as clinical engineering department, we have participated in the definition with facilities management equipment of possible expansion areas in our hospital, definition of technology needs for ICU and general ward in the expansion areas, definition of needs for that expansion areas based on the inventory we have now and what kind of equipment we can or we have to buy. technology evaluation, incorporation, and user training, technology movements of during or through the whole institution to best resolve the problems and to best put technology in expansion areas, new services opening, evaluation of masks and ongoing decontamination processes in case of problems to purchase these EPP, help physician and nurses to implement new ways to save care of patients, and the last of it is help government to know resources available in the institutions in the country to determine the best way to treat patients. That's my presentation. Thank you so much for your attention.
Thank you very much, Paula, for the excellent presentation. Very much appreciated.